Hi guys, I'm Peng Ru. Today I'll be doing a quick video on dental checkups. So at Dental Designs, we don't want to just get you in, look at your teeth, tell you what's happening, just get the treatment done and send you off. What we want to also do is to get you to really understand what's going on with your teeth, the current condition, which would then make it easier for you to understand why certain treatment needs to be done for your teeth to get them better. The way we do that is by taking photographs of your teeth with a DSLR camera that's really clear, and then we will put it up on the big screen for you to really see what's going on, okay? So today I have with me a few photos from different patients who came in just for regular checkup and cleaning. And after I take different photos from different angles, they can kind of see what I'm seeing, and then that helps me to be able to communicate. And then that helps me to communicate with them the other treatment that they need apart from just cleaning. Okay, so here's the first photo. The patient came in for just a clean, and with this photo, we can really see that his gums are really red and swollen, especially at this front area. So this is like a straight-on shot that we take from the front. If your gums are really inflamed, they look really red and swollen, like in this case. Okay, I also try to take one from the side. So if you look here, at the back especially, there's a lot of tartar buildup and everything that's causing a whole lot of inflammation. And then, with these photos, and then I'm asking a bit further, and then the patient tells me that, his gums bleed pretty frequently when he brushes his teeth, and now we know why. Okay, and the treatment that needs to be done, which is just a very thorough clean and helping him be able to maintain a better oral hygiene regimen on his own at home. Okay, next case is just a very unassuming photo taken from the patient's a bit on her left side. You don't really see much until I get her to open a little bit, and then what you can see here starting to maybe pop up in front of you is the wear and tear. So this is her lower left canine and the first and second premolars, also a bit on the upper left canine as well. So with this photo, I asked the patient, like, hey, do you think you might be grinding your teeth at night? And she said yes. So, well, this is a really good way that we can see wear and tear on our teeth as well. Okay, so just some common conditions that we spot along the way. And then the next few will just be of like decay that some patients don't feel like they have. Again, you might not see anything obvious from this photo, just what we call an occlusal photo, where we take off. So for this patient, it's his upper teeth. So you don't really see anything until I spotted something maybe going on the upper left second molar. So when I see something like that and it's not very clear from this initial photo, I try to take more zoomed in ones, which I did, and then you can see now that there's a little bit of decay on the second molar on the upper left, right? So patient came in, no pain, no sensitivity, did not feel like there was a hole on his teeth, on his tooth. Patient came in with no pain, no sensitivity, doesn't know that there's a hole on his tooth, but this photo really helps, and now he understands and he knows that a filling needs to be done. Okay, and just another one, also same thing on the upper teeth, an occlusal photo, and again, no obvious problems at all until you look really carefully and you see, hey, there might be something suspicious going on here. Looks like there's some shadowing on the underlying surface of this upper right first molar. Okay, and so with this photo, I told the patient, hey, it looks like there's something going on here. I also took an x-ray. I don't have it with me today, but it looked quite suspicious, like there's some decay over there. And true enough, when we decided to go ahead with treatment, I opened it up a little bit, and there you go. There's quite a bit of decay over there. So I think these are just some pretty normal photos that we take from the front, from the side, on the occlusal, on the upper and the lower, just to even if there's nothing, it helps to just get some records. So if anything happens down the road, we can take more photos and make some comparisons to earlier photos. If there are conditions that is difficult for patients to understand, and we want to try to get them to see what we are seeing, these are the photos that we take, and it helps a lot. So everyone's on the same page during the checkup appointment, so any treatment that comes after that can go ahead smoothly. Thank you!